So as I was saying, if you do need a DNR or DNI order, which is a do not resuscitate or do not intubate order, let your healthcare provider know about it, and he or she can write it and include it as part of your medical record, so that it's easily accessible to other healthcare providers or professionals, especially when you are admitted to a hospital or healthcare facility, or even in a nursing home. All right, so remember that it's important for you to let your family members know about all these wishes of yours. So if you do have family, friends, relatives, loved ones, you want them to be aware of your healthcare wishes, so that there's no confusion or guilt. All right, and you want them to be able to ask you questions ahead of time, concerns about your wishes, so that it's all cleared up before anything happens to you, and they won't have that opportunity anymore. All right, so we also have a POLSTS. So a POLSTS is not an advance directive, nor is it a replacement for an advance directive. All right, a POLSTS and advance directives, they're different, so just wanted to point that out, and I'll explain the differences between the two of them. All right, so we talked about the advance directives already, which is just instructions for making healthcare decisions, typically in end-of-life care situations, and it's often called a living will. All right, so it's a direction from the patient and not a medical order. All right, it's not a medical order. It's a direction from the patient, and it's put in place. All right, talking about your end-of-life care wishes. All right. Okay, so in contrast, a POLSTS form consists of a set of medical orders that applies to a limited population of patients and addresses a limited number of critical medical decisions. So the form is intended as a complement to an advance directive, and it serves as a translational tool and a continuity of care assurance. So what that means is that you need to be very careful. There's a difference between a POLSTS form and an advance directive. So I don't know if you've heard about pink slip. People do have pink slip put up in their fridge, on their fridge rather, at home, because that's where most paramedics will go to when they come into your home in an event of an emergency, to go see if you have any kind of directive or document on there. They go to your fridge and they see a lot of people put their POLSTS form, on their refrigerator. All right, so it's different in different states, so please check in with your state to see the forms may be different or called something else in your state. All right, so POLSTS form, as I said, it's different from an advance directive. Okay, advance directive, or known as a living will, is different from a POLSTS form. Advance directive comes from the patient. It's not a medical order, but a POLSTS form is for physicians. All right, so as I said, it's a portable medical order for specific medical treatments that a patient would want, based on their diagnosis, prognosis, or goals of care. And the forms are appropriate for individuals with serious illness, or if they're nearing the end of life. All right, so that's how the POLSTS form is. It's different from an advance directive. And as I said, some people put it on their refrigerator because that's the easiest place that people will have access to it. It's important that a DNR or DNI or POLSTS form is easily accessible to you, and is placed in a place where it's easily visible to other people as well, so that there's no confusion or any kind of problems when this needs to be used. All right, so as I said before, advance directives are very important, and they're very nice to have. Things that you want to talk to your family, friends, or your healthcare provider about: the use of dialysis or breathing machines, tube feeding, organ donation, organ and tissue donation, if you want to be resuscitated, if your breathing or heart rate stops or not. Those things are need to be talked about and put in place. And this is not about you wishing death upon yourself, as many people think. No, it's not. It's just a way to prepare ahead of time, and to lessen that burden that you put on your friends and loved ones making decisions, end of life decisions for you. All right, so I hope you understand now that there's we do have advanced directives, and it's nothing bad, to have. And also there's a post form as well. All right, and as I said, keep your documents close to you, so that other people will be able to see it easily. And you can always change your advanced directive. It doesn't have to be, oh, I filled it out, that's it. You can always change it, because life changes, right? What you thought of when you were 60 might change when you're 70, might change when you're 80. So you can always change it based on the life changes. All right, based on life changes, especially when people have life-changing events, like they have terminal illnesses like cancer, or they got married, or they got divorced or separated. They might want to make changes to their healthcare wishes at that point. So it's changeable. You can change it, but please make sure that the old forms are destroyed, and then you replace them with the new forms. And then everybody that you've told about your wishes before, they're updated on the new wishes that you have, so that there's no confusion going on. All right, so let your healthcare provider know, and let your loved ones know as well that you've made changes to it. And it's good for you to review those forms every 10 years, about every 10 years. All right, it's good for you to review those forms every 10 years. And as I said, when you go to the hospital or healthcare facility, if you're having surgery or anything like that, they do ask you, what your healthcare wishes are, and then they will put it in place. All right, well, I hope this helps, and I hope that you can educate other people about advanced directives, POLSTS forms, and let them make informed decision. That's the key. Let them make informed decisions, all right, regarding their health. All right, so please share this episode with friends and family. As I said before, a POLSTS form is physician orders for life-sustaining treatment. So that comes from a physician. All right, physician orders for life-sustaining treatment. It's a paper form, and it's signed in consultation with a patient and his or her doctor. And you list exactly which life-saving interventions you need or you want. All right, so it's different from an advanced directive. All right, so as I said before, the laws are different for each state. You may need the advanced directive form. You will need you may need it notarized, or so just find out, depending on the state that you are, if you need all that. All right, so talk to your doctor, talk to your healthcare provider, and let them guide you in filling out the forms correctly. All right, well, I hope this helps, and I will catch you in the next one. Continue to stay well and stay safe. Bye bye.